We begin tonight with former CDC Director Dr. Robert Redfield and Dr. Irwin Redlener, Columbia University Senior Research Scholar. All right, let's start with you, Dr. Redfield. I'm sure that I've said a lot that you don't agree with, so please tell me where I'm wrong.
Well, I think it's important. I'm of the view that vaccines are probably one of the most important gifts of modern science to medicine, and we need to embrace them. So I think we should start with that. It's not anti-vaccine or pro-vaccine. I happen to be of the view that I don't think Secretary Kennedy is anti-vaccine. I do believe he's for transparency and honest discussion about what we know about vaccines in terms of their safety and efficacy. And I think some of that has been sort of skirted through over the last couple of years. And so let's start with that and see what our colleague has to say.
Dr. Redlener, please.
Yeah, well, first of all, Dr. Redfield, I should say, was a really excellent, objective scientist running the agency. He spoke about research. He spoke about it rationally. No one ever agreed with everybody about every single point of this, but he was a scientist, and he spoke like one. Bobby Kennedy Jr. is a charlatan, as Senator Canfield said, and I'm telling you, his ramblings today were exemplary of a man who was literally out of control. He was lying, he was misleading, he was stating things that were already debunked, Bacha, as you said. It was a showcase of tomfoolery in medicine that has tremendous negative implications for the public health of Americans. It was appalling to me.
Dr. Redfield, when you speak or when other people, of more sober minds, last night we spoke to Senator Marshall, who do support Secretary Kennedy, speak about what they view as or what they represent as his view, it always sounds very reasonable. Like, yes, we should have skepticism. That's what science is. We should give parents a little bit more of a say in these things and what goes into their children's bodies. But then when Secretary Kennedy speaks, it really does seem to go in a totally different direction. Do you feel safe under his leadership of the CDC?
Yes, I do. I still say what I said when he got confirmed, that I think Kennedy has the potential to be the most consequential Secretary of Health that our nation's ever had. That said, I understand a lot of the controversies and a lot of the way people act. I thought the hearing today was very unfortunate. I think you brought it up. I think there was no real communication in that hearing. It was people with their own position. Kennedy never really had the opportunity to explain why he thought what he thought. You and I can agree or disagree with what he thinks, but I do think it's important, that you can express that. I should say for our guest that's with us, I just have enormous respect for him and his wife and his family, what they've done for the health of the world. And I just want you to know that I think what you've committed yourself to is really very special.
Dr. Redlener, I want to play for you a Republican senator, Senator Barrasso, who had this question for Secretary Kennedy. Let's take a listen.
The public has seen measles outbreaks, leadership of the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on.
And if you take a look at this, we have here the polling on who Americans trust for their medical advice. And you can see here 79% trust their personal doctor. Only 26% trust Secretary Kennedy. Dr. Redlener, I have to say, this was the first thing I saw today that made me feel a little bit better about things. Like, Americans are not actually trying to take their cues from Kennedy. They are actually relying on their personal doctors. What do you make of this?
Well, it's an interesting question, Bacha, because really, he's not a doctor. And by the way, neither was Joe Biden. And I really didn't like either any president or any secretary who's not a physician or a public health expert speaking about these things. They actually, Biden was wrong a lot of times. I was very critical of some of the statements that came from that administration also. Bobby Kennedy, however, is a whole other situation here because He is saying things that are scientifically already disproven. You know, before he became Secretary of HHS, he was probably the most influential anti-vax conspiracist in the world. And now he's got the biggest public health platform in the world to continue to influence people in the wrong way and to make the public confused. Yes, people should support their doctors, their pediatrician or family doctor or nurse practitioner, and presumably they'll get good information from them. I don't know where Bobby Kennedy comes off thinking that he can interpret scientific data, especially since he has a record of supporting debunked crazy notions about made-up dangers of vaccines.
Yeah, I mean, Dr. Redfield, is it not dangerous for him to sit there and talk about debunked studies about autism being caused by vaccines? I mean, imagine a family that has an autistic child is looking for some sort of, some help, some reason, struggling, and they hear him announcing this debunked study, and they think, oh, well, for the next kid, we're not going to give them these extremely important life-saving vaccines. Is this not something we should be worried about?
I think it's important, that we all recognize that there's no evidence that vaccines are associated with autism. I'm anxious to see what the HHS comes out with next shortly. They said they're going to come out with some views about different causes of autism. I'm not of the view that Kennedy 2025 thinks that the key to autism is vaccines. I know there's a history behind this, and that's always a problem when you have a history. I would like to see him more aggressively embrace the value of vaccines. I've said this, I think a lot of people were surprised when I supported Kennedy when he first came on the thing back in June, because I'm probably one of the most proactive scientists that embraces vaccines. As I said, it's the most important scientific gift to modern medicine that I'm aware of.
But sir, if I may, just very quickly, we only have a few seconds left. That's not exactly what I asked you. What I asked you is, isn't it dangerous for Americans to be exposed to him stating as truth debunked false claims about autism and vaccines?
Yeah, and I'm not clear that he's actually stating that. So I think, if people did take the position that these were factual, I'd have a problem with it. I think if it's people asking for dialogue around it, I wish there was more dialogue. I thought today the hearings were very disappointing because there was no dialogue. It was all one position versus the other, talking against each other. Let's have dialogue.
Well, and must contrast that with what we just had here with the two of you, such a respectful dialogue around such an important topic. God bless you both, and thank you so much for joining us.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.